Okay, thank you guys for coming here to listen to my speech. My name is Grace Gribble, and I'll be talking to you guys about why you and children need to be vaccinated. So imagine this, you just enrolled your child into preschool and you find out that it's no longer a requirement to vaccinate your kid to get into this school. And you're planning to get your child vaccinated, but you were thinking, well, vaccines are so expensive, I heard they cause autism, and if it's not a requirement, then why should I do it? So you decide to not vaccinate your kid. A few months into school, there's a measles outbreak and your child gets infected with measles and it's really bad and they could have a possibility of dying. And this easily could have been preventable if you would have just vaccinated your kid and especially gave them the measles shot, because then they wouldn't be having this. It just shows that everyone needs to get vaccinated. So today I'll be talking to you guys about how vaccines are not hard to get. They can save your life and prevent others from getting infected around you. So let's begin with how simple it is to get vaccinated. Receiving a vaccine is as easy as brushing your teeth. As vaccine is just one simple shot, it can last up to like 4 seconds and then it's over. Even though vaccines aren't comfortable to get, they kind of hurt, it's better than, in the long run, getting a disease or getting a sickness that could eventually kill you. So I'd rather experience the 4 seconds of pain than almost dying. There are many different places to get vaccinated. Usually people go to their doctor or pediatrician to get their shots, but you can also get your vaccines at local drugstores around. Like Walgreens actually has a long list of vaccines you can get there, and you can even get flu shots there for free during flu season. I'll talk about the prices of vaccines now. So if you have private health insurance, military insurance, Medicare, and Medicaid, then your shots are covered for. But say you don't have those options, there is a program called Vaccine for Children that provides all recommended vaccines at no cost for children under the age of 19, according to vaccines.gov. And I actually have a small little slideshow to show you guys kind of about the costs of vaccines and just some data. So, okay, the first thing I have to show you is just this little graphic. I found it and I believed it was really important information. I'll read it to you guys too. But it says vaccines save an estimate 42,000 lives every year in the United States alone, 3 times more than seatbelts and child restraints combined. And I thought that was just really like kind of eye-opening how many lives that saves and just how important it is to get your shots. I also have the vaccine prices without insurance, and the example shot I chose to tell you guys was the measles and mumps and rubella shots. So I chose this one because there's been a lot of measles outbreaks across the country, and this is just a really important one to receive right now. So the pediatric cost for this shot is $75.04, and it's the same cost as an adult shot if you go to the doctor and get this. And also, like I said earlier, if you decide to go to like your local drugstore and get the shot like at Walgreens, it's $100 to get it there. So I'll talk about the Vaccine for Children program prices. So if you decide to get a shot there, it's $0, and that's with every shot you can receive for kids under 19. It's at no cost. And it's pretty cool because Nevada actually has this program here, and it's for those without insurance and Medicaid eligible, and it's just, there's like no excuse for anyone to, like if they have an excuse like, oh, it's too expensive, I can't afford to get this shot, then like there's no excuse. We have this great program and other programs where you can get shots at no cost or little cost at all. The last graphic I have, I'll kind of walk around and show this one. It's the state laws requiring HPV vaccinations for school entry, providing funding to cover the cost of the vaccine or requiring public education funds. And all the states with the color have funding or some kind of funding for the shot, and all the ones in white require no laws for funding, and there's a lot of states in white. And it's just kind of like sad because a lot of kids need this shot to go to schools, and it'd be really nice to have some kind of funding or just lower price for them to be able to get it. All right. So moving on, vaccines can save not only your immune system, but your life. Some people believe that vaccines cause autism, contain harmful toxins in them, and are too much for infants to handle for their immune system. There are no studies that link developing autism and getting vaccinated correlate at all. And the doctor who wrote that statement lost his medical license because it was false, according to familydoctor.org. There are trace amounts of harmful substances in shots, but not enough to hurt someone, so they're completely safe to receive. And according to familydoctor.org, infants' immune systems can handle much more than what vaccines can do to them. They're surrounded by hundreds of viruses and bacteria, so a shot is like nothing for them to receive. Immunity protects us from diseases, and immunity is the body's way of preventing disease, and the immune system recognizes these germs that enter the body, and they produce proteins called antibodies to fight them, according to cdc.gov. As everyone knows, getting vaccinated prevents us from getting diseases and sick, so if people choose not to vaccinate their children, they are putting their child at a risk of death. And lastly, getting your child vaccinated can prevent others around them from getting sick. So vaccinated kids can actually still be at risk from unvaccinated kids, and that doesn't mean the vaccine doesn't work. It just means that sometimes, depending on the vaccine in the kid, it cannot work 100% of the time. That's why it's super important that everyone needs to get vaccinated so they can protect themselves and others around them. Vaxipedia.org says it's especially unfair that our kids are at extra risk for vaccine-preventable diseases because some folks made a decision to leave their kids unvaccinated and unprotected because they believed in anti-vaccination misinformation. Also, if normal vaccine kids that have weak immune systems are exposed to anti-vax kids, they could also get really sick. According to verywellhealth.com, even after someone with a weak immune system gets vaccinated, it's still likely to not work very well because their immune system's weak. There are many instances where kids can get sick from anti-vax kids, and it ends up being really bad. And it's just not fair because the parents that got their children vaccinated, they didn't, it's not their fault because their immune system's bad. So it's just pretty selfish for those that don't vaccinate their kids. Exposing them to these kids can get them sick. So after my speech, you have learned the many reasons as to why your child and yourself needs to be vaccinated. It's easy to receive, can save lives in the long run, and protect others from getting sick. It's not hard to get vaccinated, and there is no excuse or exception as to why your child should not be vaccinated. That is